So, an especially warm welcome to you all. As I said, my name's Justin Kuhn, and I'll be your host for this discussion. I'm dialing in from Australia. We know that many of you are in different parts of the world. And where I am from, it is customary to acknowledge the traditional owners of the land on which we're meeting. And for me, that's the Gadigal people of the Eora Nation. So I pay respect to their elders, past, present, and emerging. And I also pay respect to Indigenous people all over the world. The painting behind me comes from the Anangri people in the middle of Australia. It's a creation story from the oldest continuously surviving culture on the planet. And I think it's a memory of where we've come from. So terrific to have you all here. This is the start of what we hope will be a number of conversations with distinguished speakers. I'll say just a brief minute on the hosts of our discussion, the three hosts who've put together today's event. Firstly, the George Institute for Global Health, which is an independent global medical research institute with major centers in Australia, in China, in India, and the UK, as well as an international network of experts and collaborators. And the George Institute has three key strategic pillars around finding better treatments for the world's biggest health problems, around better care, transforming in particular primary healthcare to support better health for more people, and around healthier societies, that is harnessing the power of governments, markets, and communities to improve health. So the George Institute is the first host, thank you. The second is the Kirby Institute, which is a medical research organization affiliated with the University of New South Wales, and it's based in Sydney, Australia. Founded in 1986, initially focused on HIV/AIDS and the epidemic that we saw here in Australia. And that has expanded over time to include viral hepatitis, sexually transmitted infections, and a large range of other infectious diseases. You can detect an Australian flavor to today's organizing. Often the world of global health happens in the middle of the night for Australia. So we wanted to turn it around and welcome you to Australia. And then the third host is UHC 2030, the global movement to build stronger health systems for universal health coverage, which, as you probably know, is Sustainable Development Goal 3.8. And UHC 2030 brings together diverse partners, including governments, international organizations and global health initiatives, philanthropic foundations, civil society, the private sector, in what is really a true multi-stakeholder movement. Among other things, UHC 2030 has been mandated by the UN General Assembly to assist in preparations for the upcoming high-level meeting on UHC in September in New York. And I'm sure we will talk about that meeting in minutes to come. Very briefly, the reason for this series. The idea for this series came from the notion that we have these tremendous leaders in global health, and we often see them in very formal settings like the UN General Assembly, where, as it needs to be, conversations are often reasonably tightly scripted, and there are political negotiations going on in all of this. And so we wanted to, if you like, introduce these leaders to a broader audience, but in a setting where we could, so to speak, lift, as I say in Australia, lift the hood off the bonnet and see what's going on a little bit perhaps underneath, to inquire into the motivations and the passions and the reasons these people have got involved in public health. So we intend this is a very formal discussion. Again, thank you for the questions that have already come in, of which there were many, and please keep them coming as the conversation goes along. This leads me to, of course, our first very special guest, Maria Fernanda Espinosa. Thank you very much for joining us reasonably early in the morning from Spain. Maria Fernanda served, as you would have seen on the invitation to this event, as president of the 73rd session of the UN General Assembly. She was the fourth woman in history and the first from Latin America and the Caribbean to hold that role. And her presidency in 2019 coincided with the first UN high-level meeting on universal health coverage. Prior to her role as president of the General Assembly, Maria Fernanda was Ecuador's Minister of Foreign Affairs, as well as Minister of Defense and Minister of Cultural and Natural Heritage, presumably not all at the same time, though maybe I'm wrong. Maria Fernanda was also the first female ambassador of Ecuador to the United Nations in New York and in Geneva, and is currently lead political advisor for the UHC movement. She holds many other roles, some of which we'll discuss shortly, And in case all of this wasn't impressive enough, she's also a decorated essayist and poet. So with that introduction, please make welcome Maria Fernanda Espinosa. It's really terrific to have you.
Thank you, Justin. It's such a privilege to be with you today. I'm extremely happy to be in a setting that is more informal, that where we can exchange, some experiences and views, and also look at the future of, our healthy future, hopefully together. So very a privilege to be here. Thank you to the organizers, and thanks to you, with whom I'm going to spend the next few minutes. And again, thank you for the very generous introduction. I'm not an expert on health issues, but I had to learn the hard way very fast. And I'm a convinced health diplomat and deeply committed to not leaving anyone behind on health. And so very happy to be here this morning. Yes, it's early in Madrid, but it's even earlier in my home country, Ecuador.
Great. Well, let's start there. And before we start there, I should remind participants, or maybe tell participants, we're intending to record this conversation for posterity, and also to use in advocacy in upcoming moments. So hopefully, with your permission, Maria Fernanda and others, we would like to do that. But let's start exactly where you ended. You're a diplomat and a politician. And yet you have a key role in global health. So talk to us a little bit about your journey into politics. One doesn't become president of the General Assembly from nowhere. And then how your interest in health developed. How did you get involved in health?
Well, health is something that surrounds you, that is part of your daily life in a way, not being an expert, of course, but I was appointed ambassador to the UN in Geneva in 2014, yes. And part of my portfolio, of my responsibilities were to follow the WHO discussions and negotiations. And I had the speedy learning of diplomats, because I had experience more on the environmental front, on the human rights front, but less on health. And I got completely passionate about the importance of global health, the importance of global norm setting on the health aspects, and got very involved with the NCD's conversations and discussions, antimicrobial resistance, maternal and early child nutrition, mental health. And the truth is, people don't think about these issues as requiring a global policy guidance, international normative frameworks. Understanding the governance dimension of health. I remember having to go deep into the configuration of the Global Fund as a joint mechanism to fund, well, as we know, TB, malaria, HIV, how interesting this governance, blended leadership governance model worked. So I really, it was Geneva for me, and the work with WHO was a school on the health aspects of diplomacy and on global health as well. And at the time, Ecuador was a full member of the Human Rights Council, and the work on the human rights to health also came as one of the top priorities of my country at that time. So when I was appointed president of the General Assembly, I carried a lot of baggage and knowledge, but also of passion, interest, and political commitment, which is not only a personal political commitment, but it was a priority of the government I served at the time.
Excellent, and thank you for mentioning many of the topics which actually people have asked questions about already. You must have been psychic, but people are asking about the role of donor funds like the Global Fund and many others. So we'll get to those questions in a minute. But let's reflect on your political role, and in particular as President of the General Assembly. As I mentioned in the introduction, you were president during the time of the first high-level meeting on UHC. What was that experience like? What do you think we achieved, and what do you think we can do better this time, the second time around in 2023?
Well, first of all, I realized when I arrived that I had a lot of health-related mandates as president of the General Assembly, because you are provided with certain mandates to organize high-level meetings, to negotiate political declarations or outcomes of these high-level meetings. And I discovered that I had 3 high-level meetings happening on the health sector: the TB meeting, the non-communicable diseases high level, and the universal health coverage has high level happening the same year. And I think I discovered that all these 3 interconnected at the end of the day, and we started very early to discussing the potential contents, because it was the first time that the General Assembly called for a high-level meeting on UHC. And I landed as president. I already attended, as mentioned, the TB and the NCD's high level. So I learned from that. The sort of discussions, of course, UHC, I see it as an umbrella, literally as an umbrella of the illness-specific negotiations. And we started very early with consultations. I appointed 2 extraordinary co-facilitators. And the negotiation and the content building of the first UHC political declaration, I'm very proud of that declaration, because it was groundbreaking at the time, and proud in a larger and general sense, because it's the expression of the political will of governments, the high ambition, but also of the strong engagement of civil society and all stakeholders co-creating and co-building. And I think that this first political declaration was, as I said, a breakthrough, really put at the center the leaving no one behind part, the access to health as a human right for all, and placed universal health coverage as a political choice. And I think member states during this first political declaration made clear that choice, and also committed to double health coverage until 2030, especially considering that 5 billion people are unable to access healthcare in full around the world. So the gap on access to health services is huge in the world. So I think that basically the political commitment of advancing on primary health care and on universal health coverage was there. Looking at, ensuring that no human, had to face financial hardship because having to pay for healthcare or bringing money out of their pockets, and also making sure that the quality of services, the good treatment of the work health force, the role of women in the health in health service and the right to health was put also front and center. So I think that there were so many gains with that political declaration to make the story short. At the time, I remember that there were many headlines on universal health coverage, and basically with phrases that today the world has committed to health for all, et cetera, et cetera. So I think that it was a big gain. The other very important aspect was the biggest, and I have to be very frank, but the biggest multi-stakeholder hearing in New York at the UN that I convened as president. The level of wisdom, the level of commitment of different sectors, people, health practitioners, health activists, leading different movements, in indigenous people, everybody coming together, and that hearing was impressive. I had the privilege to lead the hearing, and the level of engagement of society, I think, made a difference and is making the difference, and that's why I'm so proud to be leading the political advisory panel of universal health coverage 2030, which is a very vibrant worldwide movement on universal health coverage. So I think it was a big gain. And what are the lessons that we can learn this time? The lessons we can learn this time is, number one, that the voices of civil society, of experts, of science, academia, health practitioners, health advocates are extremely important, because I see them as the scaffold of the decisions that politicians and diplomats make at the end of the day. But if you don't have ownership, if whatever outcome we have in this year with a high-level meeting in New York, it needs to have ownership. It needs to be implemented not only by governments or local governments. It needs to be implemented by the health workforce, by the supply and demand side of universal health coverage. So this part of political ownership is critical. And basically, we also have to acknowledge that we haven't gone as far as we needed to go on universal health coverage. A major setback with COVID-19, weakened economies of most countries, especially in the global south, of course. But I think that you can sacrifice everything in terms of public investment. The only part that you cannot sacrifice under austerity measures and in tight fiscal spaces is the health of your people. But unfortunately, it doesn't happen that way. And we understood also with COVID that strong, resilient health systems of universal health coverage, are much better equipped to face shocks, like the profound shock of the COVID-19 pandemic. So I think that we learned the hard way, and I really hope that is going to boost investment and action on universal health coverage.
Thanks very much. So many threads to pull out of what you just said, and we'll come to many of them, but maybe let's start where you ended. There were some questions about COVID-19 and how do you think the world fared? How do you think we did during the pandemic, and how do you think we're doing now?
Well, I just heard the WHO Director General, dear friend Tedros, saying the pandemic is over, the emergency is over. No, but it doesn't mean that COVID has disappeared. But what we have gone through during the last 3+ years has been very, very hard for people, for economies around the world, for human suffering. And I think that there is a lot of lessons learned. Not only what I just mentioned, Justin, saying that the better you have your act together in terms of a strong public health systems, in terms of universal health coverage, in terms of primary health care, you become more resilient and you become stronger, to really bear the brunt of a huge health emergency and pandemic as COVID-19. So that's the best way to prepare for future shocks. So we learned that. We also learned that science is amazing, and scientific collaboration is unbelievable when they work together, because we had a vaccine in 1 year. That has, I think, that has protected and saved lives of millions, and unfortunately, not of everybody. Still today, not of everybody. So the issue of access to vaccines also has had a major, was a major lesson that I think that we all learned. Also the hard way. The WHO came with this mechanism, the COVAX facility, which meant that basically the vaccines had to come to one place and then be distributed evenly and equally to everybody. And it didn't happen. We saw vaccine hoarding. We saw, some countries buying more than what they needed. We saw so many countries and populations left behind during the vaccination efforts. Again, inequalities and in selfishness, I would say, in its best. So that was also a hard learning. And then we knew, yet we knew that no one was safe until everybody was safe. So it was on our human-based interest to make sure that everybody had access to vaccines. And that's also part of universal health coverage. In some countries, societies received the vaccines, but they had a hard time on the deployment side of it, because the systems, the health systems weren't able, they didn't have the operational capacity for the delivery of vaccines. So I think we learned all of that. We learned that global health and human health requires strong solidarity, strong collective action, cannot be, first arrived, first served, the most powerful get the best and the most. It doesn't work like that. So I think that on the health sector is perhaps one of the best way to prove what cooperation, what solidarity means, in what collective interest means. What is the common good on the health dimension? So I think we learned the hard and the painful way, but I really hope that we are better prepared if we are to have a next pandemic. Experts and scientists, unfortunately, say that it is likely. And I really hope that we learn, because we had the Ebola experience, which was painful, but we also learned and we developed, collective mechanisms, multilateral responses to Ebola that were effective at the time. When COVID came, we forgot everything about Ebola, and we started from scratch again without using the learnings and the experiences of the past. So having served as a commissioner of the Lancet Commission on COVID-19, I can tell you, and many, the independent panel, as the Lancet Commission on COVID, many other commissions, many scientists, many researchers have written, the history of COVID and what are the things that humanity cannot repeat, and how the multilateral system should be better prepared to respond to these shocks that are, I would say, pan shocks, because they cover all areas of society. It's not about human security and human health. It was about our financial systems. It was about education. It was about jobs and the world of work. It was about gender inequality, in a hard way. And I hope we will have the chance to talk about the critical importance of women in health, and in women in universal health coverage, in women in the health and care work. And sorry, I get so excited, Justin, but over to you, of course.
Well, let's go right there now. And to our participants, please, of course, put any questions you may have into the Q&A section. Don't worry, I have many, many questions because, well, I have some of my own, but many people sent in questions in advance. But if you are thinking of questions as you go, please put them into the Q&A section. But let's go right there to gender equality, because it's one of your evident passions. You're chair of Women in Global Health. Your background is GWL, and you're executive director of GWL, which stands for Global Women Leaders, and is, as you may imagine, a forum of powerful female global leaders from across the globe. How much progress do you think we've made on gender equality, and what do we need to be done? What needs to be done now?
Well, I think, first of all, especially also with COVID, we discovered amazingly that more than 70% of health services were provided by women. In situations of crisis and hardship, women came, front and center to provide and care for the people that were going through very difficult health situations. And we discovered that 70% average, but in some countries is 80, 90% of women as healthcare providers and health workers. Amazingly, only 24-25% women had senior leadership roles in the health sector, still have. And basically, women count for about 30% of the health workers and have the 75% roles of leadership positions. And there was a recent study that came out from Women in Global Health, and I have the privilege also to chair the board of Women in Global Health, precisely, putting the numbers out there. And numbers matter, believe me. We strongly believe that women are entitled to equal representation in health leadership. And we also believe that we should definitely close the gender pay gap in the health sector, because women with the same qualifications, with the same merits and experience, they earn less only for the very fact of being female in the health sector. So we need, and that connects also to the care workforce. It's not only health, but it's also the care sector, childcare, caring for the elders. During unpaid or unrecognized work. And I think this has to change. One of the crises of our time is the lack of time for women, lack of time, because we are multitasking permanently. We do the domestic and care work that is unrecognized and unpaid. And we work in the health sector. We are often underpaid as women, but we have very little access to the decision-making and the power positions in the health sector. During the COVID pandemic, we saw, how women can make a difference. Women heads of state and government, as it happened in Finland and New Zealand, really taking the lead in doing the right thing in times of a health crisis. But we also have health heroines in the entire world, that risk their lives, the health of their families, to provide the services. So I think that the best service that we can pay to the health sector in general, to universal health coverage and to the universal health coverage agenda, it's really be conscious and effective about the need for gender equality in the health sector. So I think that it's an imperative, because it's good for health, it's good for the economy, it's good for society, and it's good for women's rights. We are a little more the recent report said, a little more than 50% of the world population. And we are overrepresented in the areas where that are undervalued and underpaid in society. So one of the answers for this time deficit that women have is to professionalize and to defeminize care work in general terms, but also to ensure that in the health sector, we are paid equally, we are recognized equally, we are able to access positions of power in the health sector. And I think, as I said, this is good for society. It's good to close all the inequalities gaps that society has. It's good for health, it's good for the economy, it's good for us women, it's good for society.
Thanks, and it's terrific to have people like you, and I should say my UHC 2030 co-chair, Gabriela Cuevas, and Helen Evans, former Prime Minister of, Helen Evans is here, Helen Clark, and Helen Evans, former Prime Minister of New Zealand, and Phumzile Mlambo-Ngcuka for UN Women. So there are terrifically strong women leaders, but we need more, and all of us need to pull our weight. I'm going to turn to some of the comments and questions that we've received and have a bit of a chat about how it looks from our perspective preparing from the high-level meeting. Maria Fernanda, you made a comment that when you came into your presidency of the General Assembly, you had not one but multiple high-level meetings. Indeed, at the time of the 2019 UHC high-level meeting, there was also a meeting on tuberculosis. We're faced with the same issue in 2023 because we have a high-level meeting on UHC and another high-level meeting on tuberculosis, and more recently, a third high-level meeting on pandemic preparedness and response. And thinking about it from the perspective of UHC 2030, we are struggling, may be the wrong word, but it's a real challenge to maintain coherence so that global health doesn't become more fragmented than it already is, and so that we're not separating heads of state's attention into many directions. So a few comments in this direction. One from Susanna Zhou from the McCabe Center for Law and Cancer around the fact that we are increasingly seeing many high-level meetings. How is this working for us? And what do you think about the benefits and pitfalls of the General Assembly to discuss these health issues compared to the World Health Assembly? Related question from Katri Bertram around, okay, so given all these meetings, what do we need to do to keep health on the highest, in other words, the head of state political agenda? Because the more high-level meetings we have, the less chance the head of state is going to be there. And then also a question really to focus our minds from Michael Fennelly from St. Vincent's Hospital here in Sydney about what you see as the #1 priority to achieve universal health coverage. So let's start there on the issue of coherence among the diverse health issues.
Well, you know, it's a catch-22 in a way, because we want to have health issues on top of the political agenda. And there is no better way to have health issues on top of the political agenda that get leaders to discuss, to decide, to agree and commit to health issues in general. So, high-level meetings help the political declarations and the outcomes that emerge from these high-level meetings are seen as the blueprint, as the compass of action, of investment, of policy design on certain areas. So we want that, but at the same time, I always think, perhaps in a very biased way, how much political energy you have. Having been a minister, not all the titles that you said at the same time. This was a 12-year span, my ministerial positions, not all at the same time. No, but basically you have, limited political capacity to engage, and you have to prioritize. In the case of health, having 3 high-level meetings on health during a high-level week in New York, I think it shows that indeed, health is at the top of the political agenda, especially after COVID. So it's an advantage to have all the political, energy put into health issues. Unfortunately, if I'm not mistaken, there are 12 or 14 high-level meetings happening, not all about health, but we have the SDG summit, the climate summit, discussions about the current war in Ukraine, many things happening at the same time. And if you have 3 different high-level meetings on health, there is an additional responsibility. And the responsibility is, first of all, to make sure that there is coherence among the outcomes of the high-level meeting in TB, of what is going to be discussed about pandemic preparedness and what is going to be discussed on UHC. So these overall principles, this umbrella, this interconnection between illness-specific discussions, pandemics, which means preparedness and response capacities of countries, and universal health coverage really are coherent and the outcomes are actionable. So when you go home with 3 political declarations, you know what to do at the domestic level, because as we know, health delivery happens at the national level and increasingly at the local level and at the local government level. So how to translate this into action is a challenge. For that to be translatable into action, there has to be coherence. The outcomes have to be mutually reinforcing. And I think that for this holistic approach to health, universal health coverage helps a lot. I would say it would be the common denominator or the scaffold or the bond in the narrative of health. So both, my answer would be, it is both a challenge and an opportunity. And I think that a very strong health that we expect are going to be, very strong health outcomes in September are going to feed, into the deliberations on the SDG summit. Because health, I'm convinced, that cuts across, every SDG. The issue of access to water and sanitation, for example, it's critical for health. The issue of the environmental crisis, and as we call it, the triple planetary crisis on extinction, pollution, and climate, is a determinant, to health security. If we look at partnerships and governance, it's critical for the health sector. So I think that it would be
I think Maria Fernanda might
coherence.
frozen, but you're back. You were frozen for a minute, but you're back.
Okay, good. I was going to say that it's imperative that we have coherence in the outcomes of the 3 high-level meetings on health, TB, pandemic preparedness, and UHC, but also coherence between these outcomes and the outcomes of the SDG summit coming together. Because as I said, health cuts across, every single sustainable development goal. SDG 5 on gender equality, as I said, water and sanitation and critical, the environmental crisis, climate change, everything at the end of the day ends up being important for the well-being and a healthy life of humans in this planet. So coherence, consistency, actionable outcomes would be my own asks to what is going to happen in September. And of course, again, UHC being the enabler, the scaffold to make it all happen.
Thanks very much. Your comments about implementation allow me to give a plug to the action agenda from the UHC movement. In 2019, UHC 2030 again was mandated by the General Assembly and developed the key asks for the UHC movement in a wide-ranging multi-stakeholder consultation. And I think your comments about the 2019 political declaration were spot on, as they would be given you presided. But aspirationally, it was a tremendous achievement to have the coherence among so many different global health issues represented in a single declaration. And what we need now in 2023 is a pathway to implementation. We saw this in the HIV, for example, where the first high-level meetings were more aspirational and it became more concrete and implementable. And so the action agenda for the UHC movement, and I'm hoping that someone would be able to post it in the chat, maybe I can see Katri there, could do it, is the UHC movement asks for political leaders and heads of state for this high-level meeting. And it's intended to be deliberately action-oriented with milestones. So please, as you are preparing for the high-level meeting in your various capacities, please take note of those. I would like to come to a couple of questions that came in from, well, actually, you mentioned the Global Fund in your early period as President of the General Assembly. We had a question from actually Australia's former ambassador on HIV/AIDS, Murray Proctor, and it was precisely that. What's the role of global health funds such as the Global Fund? And we could include Gavi. Helen Evans, who I mentioned before, was Deputy CEO of Gavi. And related question around financing, that increasingly there seems to be a focus on partnering for sustainability and therefore on domestic resource mobilization rather than straight development assistance. So how much impact do you think this shift, which may lead or probably will lead to a significant increase in national debt, will have on achieving UHC?
Well, I think that the issue of investing in health, you know, health is not a luxury. Health is not an afterthought. Health is the beating heart of a society. If you don't have a healthy society, that, you know, everything else, even the most ambitious, incredible projects for the future of a country are, you know, undoable and unfeasible. So the issue of public investment is critical. I'm not saying that the private sector doesn't have a role to play. They have a responsibility and a role to play, but public investment and fiscal space to ensure that countries invest in their health infrastructure, in their health systems, in universal health coverage, in primary health care, it's vital for a society. And for that you need political leadership. And that's basically the action area number one in the action agenda on universal health coverage. And political leadership is about something that is common sense. Without healthy societies, it's very unlikely that you will be able to build social cohesion, to sign a social contract in a country that is unhealthy or that has to go through incredible pain, you know, to afford health services and healthcare. And that's the beauty of the concept of universal health coverage, because your goal is to leave no one behind, so that every citizen has access of good quality health services. So I think that you need the investment, you need the right laws and regulations, you need a strong and well-trained health workforce, and you need to invest more and better in universal health coverage and healthcare in general. And you are so right, you mentioned, Justin, that healthcare should not be a burden, should be a priority. It is the best investment together with education. I think that healthy and well-educated societies are the ones that are going to survive, you know, in the future. It's not only about measuring GDP. It's not only about growth. Even growth depends on healthy souls and hands to operate the challenges of growth. And I think that after COVID-19 especially, most countries, middle-income countries like mine, low-income countries, are really under tremendous fiscal stress. So here a call to the G20, a call to the G7, to rethink alternatives for debt restructuring and debt relief for these countries. Especially, if there's a commitment to invest in the things that matter, climate adaptation and mitigation, human health, and critical, and education. But these are I would say, the priorities. And again, investing in health should not be seen as an afterthought. It should be the number one priority, and should basically come from public investment and public funds. It is, again, and I think that any political leader will, agree with that. It is the best investment that you can make in a society. And of course, when you invest, when you design the right policies and laws and enabling regulations, the issue of gender equality in health is absolutely critical, as we mentioned before.
Great, thanks. We do have a question from the floor. So with that burst of enthusiasm in the chat box, I'm going to come straight to that and ask how universal health coverage relates to another target in the SDG 3 around mental health and well-being. And perhaps I might broaden the question. How do we ensure that UHC is not just about the tertiary care delivered in hospitals, but encompasses the full spectrum of health prevention, promotion, treatment, rehabilitation, palliation? So how do we become broad, not narrow? But perhaps let's address the specific question first.
Well, I think that without, again, being an expert, but the issue of mental health is critical, and also it's been put on the side as something less important, and I think it's critical that health services include strong mental health, emotional, psychological, and social well-being of patients and of societies, and in general. Mental health is, I think, affects the ways we think, the ways we act, the way we feel, the ways we interact with society. So it's extremely important part of universal health coverage and health as a human right. I strongly believe that. And we saw, again, after COVID-19, I would say, exponential increase for the need of mental health services. But not only services, but prevention. A lot of the health challenges are about proper prevention, proper treatment, proper follow-up. And some say, but it is expensive. And I think that we cannot use the word expensive when we're talking about human health, because it is the best investment. Again, in mental health, a proper system that responds to the mental health of people is also critical for healthy societies.
Thanks for that. There's a related question around why palliative care isn't included in the action agenda, because it's essential for achieving universal health coverage, which it is. And I'm going to take a stab at answering that one, if I may, so that we have a bit of I'll give you a bit of time to relax. As co-chair of UHC 2030, I can speak a bit to the action agenda. And indeed, always in these conversations and in preparing for this discussion, where many people put questions in, questions of the nature of how can we make sure that disease X or health condition Y is included in UHC, where X might be sepsis or HIV or blindness or any of them. And all of these things are important. I guess I don't want to say the word risk or danger because I don't want it to sound like a negative. But there's this perception that when we talk about UHC, something as broad as that, everyone kind of needs to get their little piece of the pie. And again, all of the issues are important, but we potentially end up with a declaration, which is a little bit like a Christmas tree. It has everything stuck in it, and heads of state don't quite know where to go first, and governments don't quite know where to go first. So to all of these questions about what is the relationship between condition X and UHC, I would invite participants to actually flip the question around and ask, what could UHC, and in particular strong health systems and strong primary health care, do for condition X or disease Y that I care about? Because the truth is that when you have strong health systems and when you have strong primary health coverage, it helps everything. So as we move to New York, I would encourage us not to think about our own individual issues or diseases so much, and I do this myself, I'm an HIV advocate, but how can we all unite behind the push for strong health systems with a focus on primary healthcare? Because that is a coherent message that we can give to everyone in government, and that will help all of the issues that we're working on. And of course, there are times where we need dedicated and specific interventions on specific diseases. But that is the reason that the action agenda doesn't go into specific issues to the extent that it might. We really want to focus on these broader systemic approaches. So I'm going to claim that question is answered. We have about 5 minutes to go, and I would like to hand over in 1 minute to Tony Kelleher, Director of the Kirby Institute. But perhaps just a personal question to end, and this comes from Nicole Votruba from the University of Oxford. What do you think are the key qualities that have helped you succeed in your roles and positions? What has helped you get to where you are and also succeed in those roles at a personal level?
Well, that's it's a hard question, Justin. I would say, especially for us, for women, it is difficult. It's not a done deal. You have to have determination, I would say, in audacity, and because when women want to be in positions of decision making or in positions, quote unquote, called power, you're called ambitious. When men want the same, oh, they're so talented and smart, and it is difficult. But I think that as women, we have a responsibility. And the responsibility we have is to contribute and to serve and to help build, a better present and a better future for all. And in that, it might seem a lack of humility because, no one is as individual needed for anything. I mean, there's so many people that can do X or Y job. But I think that this drive to serve, this drive to build a better future, commitment, hard work, is not that some people are more wise or intelligent or talented. I think that the issue of service is about sacrifice, it's about empathy, it's about respect, it's about hard work. Believe me, I know what hard work is, and you don't. When I was a child, I had a problem at school. I would never forget what my mother told me. She knocked on my door and she said, you are a woman, and no one is going to come knock at your door and tell you, here's your opportunity. You have to fight for it. You have to put your energy, your intelligence, your commitment and your hard work into making things happen. So I would like to, especially for the young people, to say, this is easy. It's really easy. Just dream big, and then you will get there. It's about dreaming big, of course, but it's about hard work. sometimes it is also about sacrifice. And I think that we are still so far behind on building gender equal societies, in giving us women the place that we deserve and we have earned through history. We are still not there. So it's a double effort as professionals, but as women and as eternal multitaskers, as we are. So I would just say, hard work, tenacity, audacity, ambition in the right way, but I would say radical love and radical commitment to serve others and building together a better future for all.
Well, we're very glad you did fight and you continue to fight and to have us on your side. I am conscious we're basically at the hour. So very quickly as I end, before I hand over to Tony, let me just say that we've terrifically enjoyed all of the participants' input, including before the session and during it. We will post a recap on the session to all of you who registered. And also I know that many couldn't attend in person, but wanted to remain informed. We will post a recording and that recap will also include questions we didn't get to today. But it's been terrific to have you, Maria Fernanda. We're honored to have you. So I hand over now to Scienta Professor Tony Kelleher, Director of the Kirby Institute, for some closing remarks. Thanks.
I'd just like to add to those thanks. It's been a terrific first one of these initiatives, and it's been very valuable to me, and I'm sure others in similar positions to me who spend our time pursuing health equity through the prosecution of projects and programs to get a completely different view on this issue, and to get a top-down view rather than our bottom-up view, and to understand how you are thinking about making this work and putting it together, and the need to develop those strategies to influence the big picture decision makers, and how that requires what's required for the transition of the pathway from aspiration into implementation for things like UHC, and the complexity of that, and the need for consultation, planning, engagement, and unity of message, because we really need to change perceptions around cost and benefits of this approach. So thank you very much. It's been a great opportunity for us to reflect on those issues and get that different perspective. And I want to thank Justin for putting that together, and all the people at the Kirby, the George Institute, and UHC 2030 who have made this possible. Thank you very much.
Thanks, everyone. We'll see you at the next one.
Thank you all. Thank you to the organizers, to Justin. Thank you, Tony. Thank you to all.
Thanks so much.
Have a healthy week.
Good day, good night.